Perfect. Gautham, welcome to the BLUMExPodcast. How are you doing today?
Thank you. Thank you, Ravi. Thank you for having me. I'm doing good. How about you?
Perfect. I'm well as well. But you're calling us from Bangalore,
That is correct.
right?
Thank you.
Super interested in talking more about how Bangalore and India and the South, that region there is dealing with the pandemic and innovation. There's a lot of, especially South Asian entrepreneurs now on LinkedIn, and it's really cool to engage people across the world on like the different kind of strategies they employ locally on innovation and getting things to market, right? And I'm really interested in seeing like how are you guys dealing with the pandemic right now, where you live, and how's that affecting your business?
So, I run a medical device and healthcare technology company based out of India. Uh,
Hmm.
to give a brief introduction, I'm Gautham Pasupuleti from Biodesign Innovation Labs. It's a medical device and healthcare technology company based out of Bangalore. We are supported by BIRAC, Department of Biotechnology, Department of Science and Technology, Government of India, and we're also supported by Government of Karnataka, who's given us grants and research funding for our projects to develop portable ventilators and respiratory support devices that can save lives. And right now, we have been working on this project Respirate for the past 3 years. And this is the reason why we started, because we found there is a shortage of ventilators across India when we did a clinical immersion in 2017, which was leading to one of the main reasons for mortality in India is respiratory illnesses. And we found that more than 5,000 deaths, is happening just because of respiratory illnesses. If you look at the global statistics, 1 in 6 deaths is due to respiratory illness. And when we found that there was a
Sorry,
shortage of
Gautam, could
ventilators,
you could
yeah,
you bring the mic closer to you? It's hard to hear.
sure. So when we
Yeah.
found that there was a shortage of ventilators leading to mortality and morbidity, and there was an existing manual bagging which was inefficient, and we have developed a solution that is something bridging the gap between existing manual ventilation and high-end sophisticated ventilators. So the normal ventilators are very high-end and expensive and not portable, easy to use, and it is very complex. It is not something that hospitals in the rural areas can afford and can treat the patients. So we were looking at these problem statements and came up with the product Respirate. That's how we started our journey 3 years back in 2017. We started this company, and that's when we have got initial innovation award from Camtech, which was from Boston Mass General Hospital, who gave us an initial grant. We have developed a prototype, and then we have received several grants from BIRAC and DBT, Department of Science and Technology in Prayas, and we have an incubation partner, IKP Knowledge Park, CCAMP, and we have also received support from Qualcomm Design India Challenge, where we are one of the top 10 startups who have received this award. Right now, we are commercializing the product in India, and we have licensed the product to some companies who are looking to mass manufacture the product. This can be used across different hospitals in COVID. For the current situation, it can help save lives. And we also have a product called RESPAP. It's a continuous positive airway pressure device that can save lives of patients with pneumonia and respiratory illnesses. And we have also done a lot of donations for the COVID situation, where we have tried to raise some funding. We have our own funding for specific equipment. So we try to, some of the funding was used for donating masks for the hospitals across our communities in Bangalore. And we are also looking to how we can increase our capacities to manufacture in larger volumes so we could meet the demand for ventilators, portable ventilators that we're developing, and other respiratory therapeutic devices that we're developing. So one of the things that we are trying to do right now is to, since the lockdown is getting over right now and it is going to open up, the cases are going to go up. We are expecting that cases could go up very badly in the month of June, July, August, September, and there could be a second wave of a pandemic in terms of the cases. So, as a medical device company, and we are also very relevant to the current context in developing portable ventilators, respiratory support devices, we feel more responsible, and we're working 18 hours a day since February this year to manufacture at scale and to see how we could work with hospitals, governments, and across stakeholders to to bridge the gap, and how we could bring this to ambulances and emergency wards and ICUs, our devices mainly, in helping the healthcare workers and doctors who can provide oxygen therapy and other support to patients with COVID and other comorbidities. And right now we are also making newer versions of our product. So we have a manufacturing facility with our manufacturing partners. We have also licensed our product. We also have our own proprietary technology, which we are looking to license to other companies outside of India, like US, Europe. So overall, the situation is the government has done a good job in terms of the lockdown, but there is to be a way that we could come out of the situation in terms of making the business grow, because there are other sectors which are really badly affected. So the money has to flow freely, so we can make business. At the same time, there is a calculated risk that you'll have to take in terms of doing these things, because the cases could go up pretty much. That's what we are looking at, how we could help the hospitals who are in immediate need of our respiratory devices, and how we could also help the government hospitals through the tenders. And to meet that, we are working with some of the contract manufacturers and some of the licensing partners. Yeah.
Okay. I mean, thank you for the summary. It gives a lot to like digest, to go into. I mean, so just to summarize with that, I mean, you're focused on creating ventilator type technology.
Yeah,
right?
it's not a high-end ventilator. It's a portable ventilator, so sort of a intermediate.
That's mass producible?
It's something mass produced. That is correct.
So can you talk a little bit more about this market for people who might be outside of it? Like, what does the ventilator market look like, and what's the need for something like this?
Okay, so if you look at the existing...
So you got to hold your mic closer. It's hard to hear.
So if you look at the existing ventilator or respiratory therapeutics market in India, if you look at the number of hospitals, there are about CHCs and PHCs in the government side, CHCs and PHCs, and the tertiary care hospitals. And we are looking at how we could target right now for the COVID. We're looking at how we could, because right now all the patients are being treated in the COVID hospitals, which are mostly government side. And our strategy is to make our product actually targeted those government hospitals. That's where most of the patients are getting treated, right? So the market, if you look at there are government channels that we are going through, and there is also CSR, where the companies such as big corporate social responsibility organizations are looking to procure ventilators and these respiratory therapeutic devices that can be donated to the hospitals. And so these are two specific areas where the other way is to go through the private channels, which requires, so the government is slowly trying to move the patient load from, because all the government hospitals are getting filled out. Like you might have read news in Mumbai and Delhi that there are no beds for patients because it's all overwhelmed, because only government sector is getting all patients for COVID. And now they're slowly trying to channel it to the private hospitals and see how we could make it more affordable. So our first preference would be the government side, because that's where the patients are being treated. And we're also looking at the ambulance market and the emergency service market. And therapeutics market for respiratory products in India is about $8.5 billion market, but there is a lot of competition in terms of players across. There's all scattered. The market is quite scattered, and we are looking at only a specific niche area of emergency care, rural market, and market which is much more related to transport ventilation and places where there are limited ventilators available. So we are not a direct competition for high-end ventilators, but it's sort of a assistive technology for respiratory. Yeah.
Okay. Like what's really interesting about the way you describe the market right now, it's like all your numbers, what your targets are, what your competitors are. What's really interesting is like this medical technology industry is it do you think it's booming or is it changing? Right? Is it like existing systems are becoming a more higher market, or is it new devices and new ways of doing things? Is that taking off? Like, which way is it going towards?
I would say the new way of things is growing up because because when things like COVID comes into picture, which nobody has ever expected except for Bill Gates maybe. So, but as a medical device company, when we did a lot of research on the need statement and problem statement, we visited more than 100 hospitals in 2017, visiting a lot of hospitals and seeing what equipments they have, what equipments they don't have from the government sector, from the tier 2 hospital, tier 1 hospital, village hospital. We know what are the haves and have-nots, what are the gaps and pain points. Through that, we design solutions with the whole process of design thinking and the product that we have developed. And what we found that was that there's a huge disparities in terms of the numbers. What what is the population we have, and what is the actual? There are only some 20,000 ventilators for patients for a population of like 1.25 billion people. Like whereas there's a million ventilator shortage when we did a research and did a clinical immersion. So if you look at that way, there is always gaps between the patient and doctor ratio and the devices which are not available. So that's where the most of the referral happens from hospital to hospital. Patients die during transportation. There is no emergency service available, be it mass casualty, accidents, or respiratory arrest, cardiac arrest, other complications. So when there is an inaccessible healthcare for large proportion of population we are talking about. So that's where we realize that we have to make something which is affordable, producible in mass, and can be consumed, can be used by patients, and at a very easy way, accessible way, at high quality. So we know that there is a huge need for this, and we did understand that when there is some kind of I used to tell my colleagues and office staff that if there is some kind of outbreaks which gets into situation where hospitals are overwhelmed with patients, there is a need for our kind of a devices, respirate, respap, so something that patients can, get the right kind of oxygen therapy, ventilator support, respiratory support, and it is something very useful. And we don't know when to expect, but we should always be prepared, and preventiveness should be there. So that's where we try to come up with this design, and this is right now with licensing out the designs to other manufacturer to mass manufacture the product. So both is happening. One is the the new way of innovations, in vertical and horizontal. For example, one of the things that we found was for COVID patients, the lung compliances are low. So which means that the regular ventilators, regular devices might not work for the patients. So if you look at normal uh, minimum ventilators, they might not be useful for the patients because there's a need for high pressure, high volume, high peak inspiratory pressure, uh, peak end expiratory pressure. There's a lot of respiratory rate that you'll have to increase. So each patient has different lung compliances, and some of the innovations right now that you might have heard this ventilator splitters and so on. So they might not work. So it is something where you'll have to work on top of what you have already worked, because it is totally different kind of a disease, and some of the studies are coming with ventilators. Most patients die in ventilators, and so we are making something that
Sorry,
reduces
can
the
you
need.
lift your mic up? Microphone.
Yeah, so we are making something that reduces we have a product that is making reduce the need for invasive ventilation, and at the same time we also have a product which can be used for the last resort of a resuscitation and emergency care product. So we do have a product which is a continuous positive airway pressure, which is basically used as an oxygen therapy And on the other side of the spectrum, we have a product which is for the emergency care, which is an invasive ventilation. And we have modified the solution to meet the lung requirements of COVID patients. For example, COVID patients have low lung compliance. So when I say low lung compliances, so the each patient, the elasticity of the lung will require, each patient. So if you breathe, so certain pressure is required for that, certain respiratory rate is required for that to ventilate. So to say in layman's word, so when a patient has certain affected by COVID and affected by these comorbidities, so their oxygen levels in the blood goes below a specific level, which would lead to mortality. So the oxygen level is anywhere between 90 to 92%, which is the which is the minimum that you need to have.
Yeah.
So when the oxygen level goes below 90%, it's called hypoxemic. So patients get hypoxemic and they'll have to have oxygen support immediately. So that's why there has to be continuous pulse oximeter, and you monitor the patient's blood oxygen levels. So we are looking at patients who has need for a immediate ventilation, but how we could reduce the risk of likelihood that the patient would die on a ventilator. So that's why we have come up with this non-invasive ventilation product, which is something very suitable for the existing COVID scenario. And we are working with few hospitals and making it compatible with that as an oxygen therapy. At the same time, we also have this a product which is respirate, which is very suitable for the low lung compliances, where a device has been modified right now to give a high pressure, to give a high respiratory rate and high tidal volume, and at a very low lung compliance. So that is when which is very suitable. Yeah.
That's very interesting. Okay. I really like the way you describe that, because that gives a clear understanding of what ventilators do. Because we hear a lot about like ventilators, we need ventilators, why? But like what they do is sometimes overlooked, right? Now, has the technology changed to provide ventilation? How's that been modified?
Okay. So in terms of the technology, the government says that you will have to have a
Sorry, you gotta hold
specific.
your
Yeah.
microphone. You can hear you. Yeah.
So in terms of the technology, the modifications, if you look at, for example, COVID patients, there would have been a lot of things that Indian government would have learned from some of the things that has happened in Italy and US and China, in terms of using the ventilation and patient recovery with respect to what ventilatory what kind of a ventilation modes are required, what kind of a specific breath rate is required. So based on that, the government has given certain specifications, which all the manufacturers has to comply with. So when when we develop something 3 years back and 2 years back, we would have developed it for a normal lungs. We would have developed it for cases where emergency care scenarios where we would have not thought of a low lung compliance lungs. So when I say low lung compliance lungs, which means that the patient's lungs are affected with this virus or some kind of obstruction in the airway, which would require high pressure for you to inflate the lungs. So the inflation of the, so you need more pressure to inflate the lungs. So that's what we mean. That's why it's low lung compliance, because it's not compliant. And so in order to make sure our device works for the low lung compliance, we will have to make changes in the hardware design, make changes in the whole electronics part, and change in the motors, change in the PCB design, changes in the circuit, and making it testing it, and making sure it is meeting the specifications. Yeah.
Yeah. Yeah. That's interesting. So you think that amount of change is required just to change the pressure settings? Like, are these systems not built to be adaptable?
So the thing about ventilators are that ventilation, there are minimum requirements for ventilators. So one is a breath rate, tidal volume, inspiratory and expiratory ratio, peak inspiratory pressure, and PEEP, and also the alarms and other things like battery and everything. So our device provides all these functions, like providing respiratory rate, which means that how many breaths you take per minute, usually between 10 to 12 breaths per minute. So for a patient with any kind of a respiratory illness like COVID or other comorbidities, their respiratory rate is pretty high, spontaneously breathing patients. So that's why you give your mechanical ventilation has to provide that kind of a high respiratory rate. So be it from 8 breath rates to all the way to the 32 breath rate. And then the tidal volume. So our lungs have specific volume of volume. So for example, if you take a test lungs, it has 1000 to 1500 ml, but you would need to, on an average, give it 500 ml of tidal. And then the inspiratory and expiratory ratio, and the peak inspiratory pressure, and so on. So these are some of the minimum parameters that you're talking about. The specifications is what is the low end and what is the high end that you're getting.
Gotcha. So what got you into this space to build ventilators? Like why
Yeah.
why do this project?
So to give a sense of my how I got into this, and so I'll have to introduce myself in giving a context. So I did my bachelor's in instrumentation and control engineer and control engineering in Anna University in Chennai. That was in 2010 to 14. Then during my final year in 2013 and 14, I was doing various research projects along with my brother. He was working as an entrepreneur in residence along with Will Grow. So Will Grow, you might have heard. So Wilgo supports a lot of entrepreneurs, giving them as a stipend for a month and helping them run their own company. So my brother was running his own company, and I was working as a research intern in 2013 with him at IIT Research Park Madras. So that's how I got into the whole research and innovation initially. Then I got introduced with MIT Media Lab, India Design Initiative, where I got to work with various innovators and researchers across India and US. And we started working on various projects in healthcare and other design projects and other projects related to patients who has a certain conditions. So then we started working on projects.
Sorry, give me one second.
Sorry.
Sorry, continue. I can hear you. Just give me 1 second, okay?
Yeah.
Hey, sorry about that.
No problem.
When you come to the door.
So,
Yeah, you're saying, so
yeah.
what got you into this space?
So that was in 2013 when I was doing research internship. In 2014, I was done with my college, and I got an internship in Mumbai. So where I was working as a research intern and also working with the hospital to develop some products with them. Then I got a job offer from Zoho Corp, which is one of the corporate companies in Chennai. I got a corporate offer, and I was working as a product manager for 1.5 years. Then I moved back to Bangalore and started that move. When I moved back to Bangalore from Chennai, then I started working in startups along with my brother and few friends. I was working as a product manager, and I was also a co-founder of a company called CornealX. So it was in 2016 when I was involved with MIT Media Lab and LV Prasad Eye Hospital, which was working on an innovation for eye care. So one of the things that I was working in the project was developing that's how I got actually in 2016 was when I actually got into medtech, when specifically on medical devices was when I was working at a hospital developing some innovations that can be used as eradicating for blindness for a specific disease in mind. So corneal diseases was one of the main problems that we were looking at in 2016, and we have developed some algorithms and AI solution and devices that can be used for screening and diagnostics for corneal diseases like keratoconus. So then I went to Boston in 2017 and published some of the work, and I also worked with some of the researchers in Boston at MIT for this AI-based approach for cancer detection and eye care diseases like
Mm.
corneal disease and retinal diseases. So I was involved with, and I also got a job offer in Boston. I left the job and I came back to India and started this company, Biodesign Innovation Labs. That was in 2017 when I came back from Boston to Bangalore. Along with my brother, we started this company because we found that there was a shortage of ventilators. At the same time, we were also doing clinical immersions and trying to figure out certain things like what is the best pathway to go. Then we found this is a real need and for shortage as an alternative for prolonged manual ventilation, and then there is a shortage of ventilators, and we got an innovation award from a Mass General Hospital in 2017. This is when I came back from Boston and we started this company, and we have got many other awards and grants, and that's how we started the whole journey. Yeah.
Mm.
So,
Amazing, man. It's cool that you got grants and funding to do what you're doing. Now, did you get any classical training? Like, did you go to school to learn? Like, are you an engineer by trade, or what do you do for
yeah.
school?
Yeah. So instrumentation and control engineering is my domain where I did my bachelor's in instrumentation. And then when I went to MIT, I was part of this program called Media Lab has this group called Camera Culture Group, and I was involved with their group in using some of their group's work, and I was also doing 1 year research, and they were doing retinal research, and we were doing some collaboration and seeing how we could take this forward for doing some studies and using AI-based approach for screening and diagnostics. So then I collaborated with some researchers in IIT and other in IISc in Kolkata. Then we published some of the work, and then so this work was going in parallel with what we were also doing was this shortage of ventilators and this respiratory products. So that's when I jumped from eye care products to ventilators. Yeah.
Hmm.
But we still have the projects in our company, the projects that is eye care products. Yeah.
So you say eye care, like eyes?
Yeah.
What kind of products is that? What would you do?
So one of the products is using a cornea topographer,
Yeah.
which takes the image of your eye and checks for abnormalities in the cornea, and it also uses AI to diagnose, compares with data sets which are largely available, and then it gives a screening sort of a solution. Yeah. And that was in 2016 and 17. I was working, and then uh, we were much more when we started working on this project, Respirate, in 2017. We were completely involved with this project, and we started working on this project for the past 3 years right now. And right now, we are also doing mass manufacturing of this product, and yeah, and we're also licensing out the product to other manufacturers who want to manufacture and supply it.
Interesting. Cool. So, was there ever like a defining moment, like of why you wanted to get into medical technologies, designing them, studying them?
So one of the reasons was when we visited hospitals. There was a there, when we visited hospitals, we found there was a compelling need for that, need for alternatives and need for something which is unmet clinical need.
Sorry, when you said when we visit hospitals, who did that mean? Your school? Is it your
No, no,
startup?
yeah, our startup. Um,
Okay.
my brother, me,
And
and
sorry, Gautam, you have to hold the mic closer. It's hard to hear.
sure, sure. So
Yeah.
yeah, when I say we visited, which means that our team of engineers and doctors and
Mhm.
myself and my brother and our designers in 2017 we visited hospitals across India, more than 100 hospitals. We found it. We had this first-hand experience of patients who are suffering from various diseases and not getting adequate health care. not patients who are dying in emergency wards and ICUs because there is some shortage of ventilators or some shortage of manpower. So a lot of these accumulation of observations and identifying various problem statements, need statements, the gaps and pain points, and also our own capabilities of the kind of skill sets that we have, the kind of design thinking process, the whole the way of thinking to make innovations, and our technical expertise helped us to come put together and come up with solutions. That's what that is why we wanted to. So because our primary objective is to save lives. That's because we found there was patients were dying because they started the ventilators. We thought we should save lives. So that was the main why factor for us to. And we found there was a lot of technologies that we could, incorporate and using design solutions, design thinking process. And with collaboration, we have collaborated with designers, engineers, and we hired a lot of good people to build this.
Cool. Interesting. How has the experience been in starting your own company? Like, where did you learn that skill? Like, how's the startup environment in India, and how easy was it to transition from working for somebody to working for yourself?
Yeah, it's it's a different thing. So it's a lot of so when I was working in corporate, I had to report to multiple people. There was a whole hierarchy and so on. That was in 2014, 15, some early 16. And then I was working with my brother, and then there's only one person I'm reporting, and I was also working with few of my colleagues as a product manager, a few of my friends in their own startup as a product manager. At the same time, I was also working with my own brother in his previous startup. Uh, it was a different experience. Working in startup is like you'll have to do everything by yourself, and once you have certain kind of research grants, and you can offload some of your work to other people by hiring certain interns or certain engineers to do certain specific tasks. So there's a lot of project management work, and there's a lot of planning and preparation goes into early phase of when you're doing things. And as the project goes on, you need to have a very good leader in the team to to make sure the technical things go parallelly, like electronic side, mechanical side, and the regulatory side, documentation side. So there has to be a strong leadership under you to take care of things. So that's what we find. We found some reliable people, engineers and product designers and industrial designers and embedded engineers, robotics engineers, regulatory consultants, and yeah. So it was a different experience. So you because you would try when you got a lot of your own first-hand experience working with big team leaders and bosses, you would know how a company works on a higher scale. And when you're coming with startups, so you'll also having you want to formalize things, but at the same time you want to keep it simple, and you're not making a lot of efforts to make so much of hierarchy, but we keep it simple. The startups, we try to keep it simple, but in corporate, it's very hierarchy and there's a lot of complications. So I would say it's a very different environment, polarizing. Uh, but I'm glad I had opportunity to work on both.
Cool. Interesting. Now, any questions you might have for me, or anything else you want to segue into?
Um, I have no questions. I just want to know how the situation there in Toronto. How's
It's weird because it's really quiet. It's like, we hear the news and you're seeing like riots in the US and like all these hospitals going through emergency situations. But when we look in our streets and we walk around, very little is going on, especially in Toronto and Markham. Now, over this weekend, there's been a few protests. If you're following what's happening with the George Floyd situation in the United States, it's spilled over to Canada as well, and globally, really. So I've been watching that kind of tick off and tick off. Like this weekend, I had reserved to like do a whole bunch of like research into a few things, initiatives that are going on, but I never got around to do that at all. to be honest, just because of this whole the resurgence of the Black Lives Matter movement and what happened to George Floyd and the spiraling behind that. There's so much content coming out of what people are feeling with, and I feel like we've been so concerned and preoccupied by this virus and the lockdown procedures and economic pitfalls of that we have underlooked the emotional issues that people are going through. Like we talked about it as mental health and all this, but the sheer anger and frustration that people have that is pent up in large parts of our population, it just sparking out and coming out, right? And I talked about this on my Instagram page too, like how like the George Floyd situation was just like a spark to get people's like anger out, and now it's evolved beyond just like, sorry, go ahead.
Yeah, this lockdown and coronavirus, the whole situation for the past 3-4 months has put everyone in a bad place, I would say, in terms of mental health, in terms of the way we interact with our friends, family.
Yeah.
I
think it's easy to, yeah. I mean, people like you and me, we're busy. We have found ways to keep contributing value, right? Keep ways to building something, or to feel purposeful. There's a lot of people that's been removed from that, and I know, and they've been told to adapt and to modernize and to change, but with very little economic output and ability to do that, like there's large parts of the populations in all nations that are super adversely affected. And what I'm afraid of is like more of these situations are going to come out. These lightning bolts are going to pop up over the world. That's going to lead to like more large-scale riots and demonstrations and anger, and those kind of things like build up. That's when like populist regimes come to power, and governments crumble and things change, and the world destabilizes, right? So what I'm looking for is like, how do we get more resources to the people, right? To make them feel resourced, make them feel purposeful, make them feel involved with the change, so that their frustrations and anger, their emotional output can be vented towards something productive.
The jobs, they need jobs, and things have to get back to normal.
How's that situation in India with that? Like, I know there's like a big concern of migrant workers trying to go back home now and causing a second wave of like.
Yeah, that's a really bad situation. I mean, very bad situation, I would say, because a lot of people are stuck in their home. One hand the parents
got the mic, the microphone.
Yeah, at one hand the parents are at home. The other side, the people, young people, they are working in different cities, and they want to go home because they have to see their parents, or they had to take care of their parents for some medical emergencies. So it's a huge situation in terms of the migrant crisis that we are going through as we speak. I think there's a lot of things that government had not taken into consideration while making certain announcements. So these are some of the calculated things that the government should have expected, and should have done something beforehand, rather than happening and trying to make it. So this is a downside of the lockdown, right? So when you have a lockdown and you try to impose a lot of rules, which is important, but there is other things also you have to bring into policy considerations, where how you would safely transport people, how would you feed people who are not able to get paid. A lot of people are dying in hunger, and a lot of people are not able to get adequate supply to food, water, shelter. It's a bad situation, and we need to do something about it.
Yeah, absolutely. And like the question is like, how do we get better feedback systems, right? How do we understand people better? How do we figure out problems before they happen, right? Like, how does that happen with government and the people? Is there any solutions being put forward?
Yeah, there's a lot of use of technology. Like if there is some people who are stranded, we have Twitter, and we have all the social media that's reporting to the public, reporting to the authorities. we need much more faster, and we need to have that the responsibility of the local government, the the administration to take care of these people. There has to be a relief fund for the migrants. Yeah.
Okay. And like how you and your family have been affected? Like, how have you been doing during the lockdown times
No, we are
during
all
the pandemic?
together. It's all fine.
Yeah, it's all good, right? I'm talking about more about like, how you've been productive. Like, how's your like schedules changed? Like, you're still coming to the office. Like, things open,
Yeah, yeah.
accessible.
So, yeah, I was working continuously for during March, April, even in early May. We're working continuously from morning till late nights. Sometimes it goes till 17 hours, 18 hours, and then I go back home, which is just walkable from my office, and then can come back after taking a nap and shower or having some food. And it's a small breaks, and then yeah, it's just going, just work, work, work. Yeah, just, that's my routine during this lockdown, and because we've been very busy with getting a lot of orders and a lot of manufacturing which is going on. So I have to oversee the manufacturing, the project management, a lot of updates and things like that.
Amazing, perfect. Well, Gautam, this has been great. I had a blast talking to you, and learning a little bit more about what's happening across the world, and how you guys are contributing to fighting COVID-19. Um, how's like one thing I forgot to ask with your product? Are you manufacturing it directly locally in India? Like, are you manufacturing somewhere else? And what are the timelines? Like, are you production ready? Are you?
Yeah. Okay. So the device respirator is production ready, and we are manufacturing in Bangalore in India. And we are also tied up with a few other companies. We have given non-exclusive licensing to them, so they can also manufacture and supply to the hospitals and across India. And we also have talks with other companies in Boston and in UK and
Yeah.
in other few other countries who are also willing to take our license for manufacturing our product and marketing it.
Mm.
And so right now we have orders from Bangalore and from Chennai and from Kerala for our product. And we are also going to supply to the government channels through government-owned procurements and so on. So we will be supplying to the CSR and NGOs through who will supply to the hospitals, and we'll also supply to the governments through the orders that we will be getting.
Has it been hard getting supply chain to get the manufacturers up behind you? How's that
Yes.
process been for you?
Yes, so during the early lockdown days, we had a huge struggle in trying to get the products because there was a huge demand for the products and there was a lockdown at the same time. So it was a very difficult situation. We had to contact the government authorities, IAS officers, to help us reach out to the customs officers to clear some of the products, parts that we have ordered. So there's back and forth going on, and we figured out a way to get it sourced through some of our channel partners. Yeah.
Hmm. Cool. Awesome. Well, good luck moving forward, and wish you the best. Where can people find you to support you more or learn more about what you're doing?
Sure. You can just go to our website, www.biodesigninnovationlabs.com. It's biodesigninnovationlabs.com. And you can
Perfect.
also find me in Twitter, find me in Twitter and Instagram and Facebook. Yeah.
Perfect. Awesome.
Thank you.
Gautam, this has been great. Great talking to you. We'll end the episode here.